about the, I think you call it intranasal vaccine? Is that for a special group, or what's the benefit of that?
There are two vaccines that are available. One is injectable, and the other one is an intranasal spray type vaccine. And about 5% of the total vaccine that will be produced will be this spray vaccine. However, it was the first vaccine that was available to us, so we have a lot more of that right now in terms of availability than when we think about the whole picture of vaccine. But this vaccine is easy to administer. It's administered in the nose. It's a great vaccine for children because there's no needles involved. It's as safe and effective, but it has a little bit limited age range. We can only give it to people that are 2 through 49 years of age, and they generally have to be healthy to receive the vaccine. So it's a good choice for healthcare workers. It's a good choice for people who take care of young infants. And we have plenty of this vaccine right now available, but some people have been apprehensive about taking it because it's different and new. But the seasonal vaccine is also available in an intranasal form, so it has been on the market for many years.
Okay. Do you have enough health workers out there to administer the vaccine?
We are working our staff, pretty much all of our nursing staff is part of the community clinics that we're running, and we're shutting down our normal clinic operations to do this. We have also hired a number of temporary staff, nurses from the community, nurses that work in doctors' offices and hospitals, to help us with this vaccination effort. So we think we have access to enough staff to actually do this, but that is a concern that we may not have enough staff to conduct a clinic.
I mean, you see the lines outside different areas now, and you obviously you're concerned about the cold weather, these people waiting in line outside. I know just recently they went to the Palace in Oakland County to get more people out of the weather. Right. Is that kind of the same plan here in Macomb County?
We'll keep using Freedom Hill for the next few weeks as long as the weather cooperates. But if we have weather issues, we may have to look at other facilities to do this. We are able to get people through within about an hour and a half, even on the busiest clinics that we've run. We're capable of doing about 600 an hour at Freedom Hill. So we can do 4,000 to 5,000 people in a typical 6 to 8 hour clinic.
I understand there was some conversation about opening up a center here in Warren, the city of Warren. Do you have any information on that, Doctor?
We have had some discussions with the city and possibly doing something in this part of the county, and those we are definitely open to doing something like that in the near future.
Okay. Let me ask you, how do you prevent? I mean, if you could share with our viewing audience, how can you prevent becoming a victim of this swine flu?
Certainly vaccination is the best way, but obviously with this shortage situation, many people are not going to get vaccinated at least as quickly as they would like. The general recommendations really are pretty simple, and they're both for seasonal flu as well as H1N1. If you are sick, you should stay home from work or school. That's not always easy, but we do recommend that people do the best they can in doing that. If they are if other people are sick around them, try to avoid being around sick people. And then just general things, hand washing, covering your mouth and nose when you cough and sneeze. These are just basic things that can go a long way in protecting people from getting infected.
Is it better to use something other than soap to wash your hands with? Is there some other...
Soap and warm water is the best. But there are products on the market, these lotions and sanitizers that can be used if you don't have access to soap and water. So they're both effective. I think I would use soap and water first. If that wasn't available, then I would go to one of the products that are available, lotions that have antibacterial and disinfection processes, product like that.
Okay. Maybe you could go over what the symptoms are of swine flu.
The symptoms of swine flu are very similar to seasonal influenza. People will have a fever, they will have a cough, sore throat, runny nose, muscle aches. Many people will be really kind of wiped out for several days. They'll talk about sleeping a lot, laying on the couch kind of thing. If anybody has difficulty breathing, has a fever that they can't bring down with Tylenol or Motrin, ibuprofen, then that's a signal that they should seek medical evaluation and be seen by a physician. They may be having something more severe going on.
How do you see this playing out as far as the deaths that we're experiencing here in Michigan, in the Tri-County area, and throughout the country?
Right now, this virus is widespread in about 48 of the states. It is widespread in the western part of Michigan right now and in the Upper Peninsula. We expect that there will be a progressive increase in the number of cases here in southeast Michigan in the next several weeks. In terms of the mortality rate is less than 0.1%. So in absolute numbers, I think that the number of deaths will be small. And of the deaths we've seen right now, they're mostly in people who have underlying medical conditions. But as more and more people get infected, if 20 or 30% of the population is infected with this virus, in absolute numbers, we will see more people hospitalized, and there will be the potential for more deaths. But generally speaking, it's a mild illness for most people, but in a small number of people, it can present serious health issues.
If I've had the seasonal type flu vaccine, would that protect me from the swine?
No, it will not.
Will not.
The new H1N1 virus is a unique, different virus, and so that's why they had to make a second vaccine specifically for that, is because the seasonal flu vaccine is not likely to provide much protection against it.
So are we saying to protect ourselves we have to get both vaccines?
That's correct, yes. Now, keep in mind that the priority groups for the H1N1 vaccine right now are a little bit different than they are for seasonal flu. But yes, people generally want to protect themselves from both of these viruses. They need 2 vaccines.
Getting back to the age group again, the seniors in the community, they're not as vulnerable to the swine flu as they are to the seasonal flu. Is that correct?
Correct. This has been a challenge for us to communicate this information. Seniors are used to getting seasonal flu vaccine, as they should. The issue with this new virus is that it is predominantly affecting young people. And older individuals, seniors, those 65 and older, have not been as affected by it. And the reason for that is that many seniors may actually have some residual immunity from being infected with a virus decades ago that may be similar to this H1N1. So the initial target group did not include senior individuals, but that does not mean that seniors won't be able to get the vaccine once we have more available. It's just that we're prioritizing right now to those who are at highest risk.
So the seniors aren't at high risk at this time?
Correct, yes. They are not at high risk compared to very young children, young adults, pregnant women, and the other groups that we're targeting for vaccination.
Okay. So again, getting back to the various locations where the vaccine will be administered, you see an increase in locations coming soon in the Macomb County area?
We hope that will be true. It will depend on how much vaccine that we have, and that's a tough thing to predict. We basically get these allocations every week. We don't know how much or when, and so it's very hard to predict. But we hope that we will have more vaccine throughout the month and be able to do more clinics.
How about getting back to the schools again? You still plan on getting into the schools to administer the vaccine soon?
We need to look at that. Again, it's going to depend on vaccine availability. The other issue is if we have a significant wave of illness that comes through in the next several weeks, and we have a lot of illness in schools, a lot of absenteeism in the schools, it may not be warranted or justified. It may not be necessary to go into the schools anymore because many of the kids will have actually had the illness, and it won't be worthwhile going in. But we have to look at that and see if it's possible. We may be able to do some clinics in December, but that has not been decided yet.
Okay. You don't see schools being closed down as they were a few months ago?
Well, we won't be closing schools for having an individual case of the flu, but there have been hundreds of schools across other parts of the state that have closed over the last couple of weeks because they have so many kids out that are ill, so many staff members that are out ill, that it's really not possible to conduct classes and have a normal day. So many schools that have had a lot of kids out sick have actually closed for 4 or 5 days or a week or so on their own because they simply can't function.